Hello friends, in this video let us see about the great saphenous vein. So first of all let us see its formation. It is formed by the two veins, okay, combination of the two veins. One is dorsal venous arch of the foot, okay, its medial end, that means medial end of the dorsal venous arch of the foot and medial marginal vein of the foot, okay, it is nothing but the great toe, okay. Next, the course where it runs, okay, it runs upward in front of the medial malleolus, okay, it runs upward medially to the anterior to the medial malleolus, okay, upward in front of the, in front means anterior to the medial malleolus. Next, it runs along the medial side of the leg and it crosses the knee joint posteromedially, okay. Next, it runs along the medial side of the thigh, so it is given easily one by one, so it can be easily understood here, right? Next, termination, it pierces the cribriform fascia and it passes to the saphenous opening and it drains into the femoral vein, okay. Next, what are all the tributaries? So in leg it gives two tributaries, anterior leg vein and posterior arch vein, and in thigh let us see one by one. So in thigh, before piercing the cribriform fascia and after piercing the cribriform fascia, they will give some certain tributaries. So what are all they? In before piercing the cribriform fascia, it gives superficial epigastric vein, superficial circumflex iliac vein, superficial external pudendal vein, and after piercing the cribriform fascia, it gives one deep branch or deep tributary, deep external pudendal vein. Okay. Next, what are all the communications? It communicates with the deep veins. Only communication is with the deep veins. Okay. Next, what are all the perforators? There are totally 5 perforators. So let us see one by one. So it first one is 3 medial ankle perforator, okay, on the medial side to the ankle, and one below knee perforator, okay, and in mid thigh, that means mid thigh perforator, okay. Next, let us see the diagram. So let us see the formation, course, termination, tributaries of the great saphenous vein. So first of all, now the great saphenous vein, right? This one is great saphenous vein. It is formed by the combination of dorsal venous arch and medial marginal vein of the foot, as I already mentioned, right? So let us see the applied aspects of the great saphenous vein. First of all, it is varicose vein is most common type of the applied aspects of the great saphenous vein. Okay, in this case, veins become dilated and tortuous. Okay, so mainly which veins mean? It is superficial veins get dilated and tortuous. So it is caused by long standing. Okay, it is due to long standing. Okay, next, it is present in the people like nurses, teachers, and long-standing people like traffic policemen. Okay, so varicose veins, it is due to incompetency of the valves in the perforating veins, okay, and also due to the incompetency of the valves at the termination of the superficial veins. What does mean by incompetency? Incompetency is nothing but inability to do or push something, okay. In this case, veins can't able to push the blood, enable or incomplete, okay. So the incompetency can be found, okay, by two tests. One is Trendelenburg test and the Perthes test, okay. This test particularly we do for superficial veins incompetency, finding of the superficial veins incompetency. So in this video we have been clearly learnt about the great saphenous vein. So thank you for watching.